Hello, my name is Eileen Davidson, also known as Chronic Eileen, and I'm here today with Cristina Montoya to talk about diet and rheumatoid arthritis. We do have a special guest with us today, my cat Peanut. Here she is. She won't listen to no, so she has to hang out. She's very interested as well. Anyways, I'd like to pass it off to Cristina to tell us a little bit about herself and the amazing work that she does and her perspective as not just somebody living with rheumatoid arthritis, but also as a registered dietitian.
Thank you, Eileen. I'm so glad to be here with you and with Peanut. I'm a dietitian and a person living with rheumatoid arthritis for over 20 years. I also been a dietitian maybe as long as I've had rheumatoid arthritis, 20 years. I started my career in Colombia in 2005. 20 years. But no, probably over the past 5 years, I've been dedicating a lot of time in empowering and educating women, or not women, but everybody about the impact of nutrition on in rheumatoid arthritis or Sjogren's disease. What I find interesting is that I spend a lot of my time is busting myths and it's educating people on how to navigate the evidence and what to believe. Because as someone, I've been a dietitian for so long, and I was diagnosed while I was following the most strict diet. I have no exposure to any toxins. I was exercising every single day, and I still developed rheumatoid arthritis at 22, which was considered severe, so severe that within 6 months I had joint deformities.
And that was during your schooling for registered dietitian?
That was while I was studying for being a registered dietitian, and at that time, it was 20 years ago. To be honest, there was no evidence, no research that was done on the relationship between diet and rheumatoid arthritis or any other inflammatory arthritis. And so I remembered my first patient, and when I was with my internship in Colombia, it was a lupus patient. And they were still trying to figure out which diagnosis I had. But that person impacted my life because she was only 33 years old with two little kids, but she was in the end of life care. And she knew that her death was imminent because her organs just shut down, and she was crying. And I ran out of that room crying, going to my preceptor, and it was a very, very traumatic experience. But I shouldn't say push through. At that time, it was so embarrassing to say I had pain. I was young. They said, oh, it's only for old people. It still happens. So I didn't want to show any weakness. I wanted to graduate with my peers. And I suffered extreme pain during my last year of my nutrition career.
I'm sorry to hear that. Now, what about being in remission? Or well-controlled rheumatoid arthritis, what does that mean to you?
Wow. To me, it means hope. And the fact that I'm experiencing right now after 20 years, it is unbelievable, because the rheumatologist who diagnosed me with rheumatoid arthritis in Colombia, his prognosis was that by my 40s, I'll be in a wheelchair. At that time, we didn't have access to buy the newest therapies. It was kind of the old therapies. And for those who had access to the novel therapies, it was very expensive. So I didn't have access to it at all. So the future was dark. I was very scared. I saw myself only buy medications, and I said, why am I going to go to school? I'm going to never believe that there was a possibility of remission, or there was a possibility of feeling no pain or very little pain in my lifetime. I have to be honest. It was because it didn't happen for almost 20 years.
What do you want other patients to know about remission with rheumatoid arthritis?
One thing, that it is possible. So my understanding of remission is going through certain period of time. My rheumatologist told me maybe from a year or so with minimum symptoms, also with inflammatory markers very, very low or minimum. But I think the most significant part of being in remission is to not feel pain. One thing I'll recognize is that remission doesn't mean cure. And it is still possible to have those days that are up and down, and to recognize that if at some point the rheumatoid arthritis awakens and brings me pain, it's not my fault. It is just the course of the disease. And we have wonderful medications compared to what I had access to 20 years ago, but there are treatments but they're not a cure. It's a treatment. It's like when you are diagnosed with diabetes, there are many medications that are available to help you manage your blood sugars, but it doesn't mean that it's going to cure your arthritis. So that's how I see the management of rheumatoid arthritis, that you need to have that strong collaborative relationship with your healthcare provider, your rheumatologist, person where you can discuss your treatment. To me, medication, despite some of them working, some of them not, still is my first anti-inflammatory tip, is to be under treatment that can help modulate my immune system and reduce the symptoms.
Mm-hmm.
So that relationship with your healthcare provider is essential. I have never been without rheumatologist, never been out of my medications without consulting them. And right now, I've been on remission for almost 2 years, which is amazing. Like I said, it's great to see. And I'll still go see my rheumatologist. See, to me, it's like for me to start, I used to see my rheumatologist almost every month at some point after I had my boy in 2019. I used to see her almost every month, every couple of months. And to me, seeing the rheumatologist that often, that means that like something is just terribly wrong, because you don't really see a rheumatologist that often. Now, this year, I only saw her once. And my next appointment is because she decreased my medication, which is what's like, whoa. So it's amazing. So but again, everything I do is with her, in collaboration with her.
Mm-hmm. Absolutely. Now, you as a registered dietitian and person living with rheumatoid arthritis, you've touched base on there isn't a cure for this disease, but there are treatments. And there's also a lot of myths around rheumatoid arthritis, especially when it comes to diet. Can you walk us through a few of those?
I'll tell you one that it doesn't die, and it's the nightshade, the nightshade vegetables. That's the one I was told when I was back in 20 years ago, and I said, well, you shouldn't eat tomatoes, potatoes, and bell peppers, eggplants, and I, in my mind, I said, okay, why don't we just kind of separate, the myth from the fact. Those vegetables actually contain a lot of antioxidants, vitamins and minerals, fiber that we all need. The fat probably, or the myth, comes from the content of selenin, right? So the selenin is like this molecule that kind of is in these vegetables to protect them, like, against climate and other predators, maybe, to eat them. but they're not necessarily toxic to human unless you eat more than 200 potatoes a day, which I don't think we do.
Very.
And maybe the word actually is that the highly concentration of selenin is on those potatoes that you can see they have like some green spots on it. So then you will avoid that. Actually, I do avoid those because I know there's a higher content of selenin, and if I'm maybe slightly sensitive to it, I might have some reaction. But is there any particular connection with rheumatoid arthritis? There isn't, and I've been looking at it for 20 years, and I'm sorry. The only thing that there's kind of is emerging, I've seen as I'm also passionate about gut health, because I see it's so important because, you know, the immune system basically is held in your gastrointestinal tract. They have seen some connection with the nightshades and with exacerbating some for people with irritable bowel syndrome. So that seems more at the gut level. But that's again is emerging. So another thing that I will give, and is tomatoes. Tomatoes tend to be very controversial. Some people react to them, and there are reasons for you to react to tomatoes. And it's not because of the nightshades or the selenin. The reasons you react to tomatoes is because maybe you're allergic to latex, and then some proteins of the latex is in the tomatoes. If you have histamine intolerance, so tomatoes, and when they're like ripened, it has a high content of histamine, tomato products, you're gonna react to them. And so you will feel, and some of this reaction is fatigue, as stomach pain, it's you know, feeling really like a heartburn. So then you will associate as the, oh no, so that's affecting my arthritis. So it's important to really separate the facts from the myths, and what is the evidence, and most importantly, how do you feel about it? It's that if you truly believe that is affecting you, keep a journal for like 2 weeks and keep details, and also consider everything else that you're eating, not just the nightshades.
What are some
That's
of the myths around rheumatoid arthritis and diet? There's quite a few, but what
Yeah,
usually
that's a
five?
big one. Okay, so the other one that it was very popular, and I think it's lingering around, is the celery juice. That basically there was this medical medium. I don't even understand what that is. I don't think that person is a doctor, but this person just promoted so heavily that celery juice cured so many illnesses, especially arthritis. And so taking fresh celery juice first thing in the morning will cure the arthritis. Surprisingly, I have heard some people who have drinking celery juice, and I have relief of their symptoms. But I think what we need to keep in mind is typically when we make these drastic changes or we add something new, one, it could be the placebo effect, and that's very powerful. Like some studies, even like 40% of the participants can have the placebo effect and relieve those symptoms. Two is that maybe you're making also lifestyle changes at the same time, but maybe you're also modifying, maybe you're consuming less saturated fats, you're also eating more fiber during the day, but you're just fixated on the celery juice. Celery juice, I acknowledge there's vitamin C, vitamin K. When you actually eat the celery, there's lots of fiber. It has a high water content. It's a great vegetable, but to really give it that title, I won't. That is going to cure arthritis, definitely not. Though another one that it's very interesting. It's about meat. Can patients with rheumatoid arthritis eat meat, especially red meats? So again, there has been a lot of controversy in the past, I don't know, decade, as to why the red meat may increase also the risk of cancer, colon cancer specifically. But if you compare, like I said, I'm saying as someone is Colombian, and I came as an immigrant to Canada. In Colombia, when I used to eat meat, it was no bigger than the palm of my hand. And I will eat it maybe once a day at the most. but mostly what was surrounding that piece of meat, it was beans or lentils or with rice or corn, salads. Then we have like fresh juice, avocado. So it's the meat, really, it wasn't the main part of that meal. It was just something, just an accessory. When I came to Canada, it was all the opposite. The beans were served like in this little tiny container. So when I went, oh, we have baked beans. And the baked beans were laced with maple syrup and sugar. So I think it's just how we prepare that meat in how we balance our plate. It's true. Plant-based diets, particularly the Mediterranean diet, has shown like benefits. Some studies have said, yeah, it reduces some joint tenderness and some inflammation. But if you look at the study, not just the title, but the methodology, most of these studies, the participants must take or must be taking their therapies for rheumatoid arthritis. Rarely, and it would be unethical to have a participant without their medications to participate in these studies. And that's what they ignore. All these influencers of people telling you this is what is going to work. So when they said, so can patients with rheumatoid arthritis, can they eat red meats? They can. They can eat in moderation. If you follow the Mediterranean diet pattern, that means that you only eat it maybe once a week, every couple of weeks. So that's when the messaging changed. There was this lady who, from Toronto, unfortunately, that promotes the carnivore diet that cured her disease. And just don't want to say her name here, but I probably know who that is. And she just gorgeous. She looks like a Barbie doll. It's
Father.
good for her. You have all the money in the world to buy meat because it's so expensive. So good for you. But is really the evidence? If I see a carnivore diet, I feel constipated just to look at it. But there's no fiber. So there's no evidence to go to all the extreme to say that carnivore diet is gonna cure or improve symptoms of arthritis. But there's also not enough evidence to say that you have to go completely vegan when you have rheumatoid arthritis.
It's finding that balance that works for you.
Mm-hmm.
And
exactly.
Everyone is different.
Exactly. What's another one? Which one that you're curious about?
How about turmeric? We hear that one a lot. Turmeric, yoga.
Oh, turmeric. Turmeric, it's actually I got to know turmeric through my in-laws. They're from Pakistan, and they were the ones who introduced me to the golden milk. They actually, from their culture, they mix turmeric with milk. They warm it up with a little bit of honey, and they believe that helps with muscle pain, right? So I can understand where all this came from, and let's say there's some truth to it. Like the turmeric, like they have the active component, which is the curcumin, that has shown some anti-inflammatory effects. But here's the trick: it's not very bioavailable, meaning that the body doesn't really absorb much of it. So I think you absorb only like 5 to 10% of what you eat. And I hardly see a person who will be able to take like 2 tablespoons of that turmeric because it's earthy, can be bitter. So if you're using it for cooking, it's also essential that if you want to get some absorption, you want to make sure that there's black pepper. So there's the pepper that helps with the absorption, and also a little bit of oil, could be the olive oil or the coconut oil. Or when you're making golden milk, you make it in, I don't know, coconut milk, or if you tolerate milk, and also add a little bit of pepper. Is it easier to measure how much curcumin you're actually taking? It's really impossible. And when it comes to research, and that's where a lot, even pharmacists, I've seen that they cling on to that, which is, it blew my mind to see a pharmacist promoting turmeric or curcumin supplements for people with rheumatoid arthritis. That's something I saw on TikTok. I was like, what? So this person said, no, I have the supplement. It contains 500 milligrams of turmeric, and you take this 3 times a day, and if I will promise you, you will feel 100% better. And I said, how? That's a red flag right there. You just someone to promise you 100% that you're gonna feel that way, just no way. That's the evidence is. There was a small study, and I believe it was mostly done for people with osteoarthritis, where it was about 3 months, and they gave them like a 500 milligrams of turmeric extract, and for like 3 times a day, and they saw some decrease. They actually compared to anti-inflammatories medications, and they saw a similar effect. But what are the side effects? Some of the side effects were like a heartburn. They acknowledge that there's interaction with blood thinners. So if you're taking medications like blood thinners, it's a big no and not a drug interaction. And I find that most people actually feel mostly stomach upset when they take so much turmeric. My advice, honestly, enjoy turmeric. It's an amazing spice. I love it. It gives color to my foods. It gives some flavor. Just enjoy it in your food. I do enjoy golden milk, and maybe it's the placebo effect, but I do feel better when I drink it.
I do believe that turmeric can be a part of our anti-inflammatory focus. It doesn't need to be a whole diet. It could be a focus. So yeah, that's an interesting point that you brought up there, that, if sometimes the benefits are outweighed by the negative side effects. I know that it quite upset my stomach, and I already have GI issues coming with my rheumatoid arthritis. So I have to be very careful about what I eat.
Exactly.
Yeah. So you've gone over some of the myths, and there's quite a few. There's intermittent fasting. People with RA should avoid carbs and all grains. Dairy products should be avoided. Gluten-free diets are always best. The AIP diet is, going to cure us or heal us. Whenever I hear the word heal, when they're selling you a program or selling you something, I cringe, because it's like they're lining their pockets. So yeah, how do you find information? Like, how do you navigate the sea of misinformation out there?
I think I hold on to my training as a registered dietitian. I went to school for 5 years, and after that you have like this ongoing obligation of keep up with the latest evidence as much as you can, because now like research is by the minute. And so it's like finding ways to, there are organizations that filter that information for you. But I think when you actually have this academic training, that you're able to read some of the research, what research actually works, like this was bonkers. This has like nothing to do. And I think that gives you that I guess the qualifications to interpret a lot of this information. And because nowadays, unfortunately, some information actually comes from what you so-called experts, so medical doctors, or even other dietitians. Like, you don't know what the agenda is. Is their agenda is to get more likes and views on their videos, or is it truly their responsibility is the public interest, is to protect the public? And that's the role of the registered dietitian. Also, as a registered dietitian, we are qualified to provide medical nutrition therapy. I was just thinking about, I said, when have you seen a holistic nutritionist in a hospital and providing care and advice for a patient who had just had a heart attack, or a person who was in ICU? Have you ever seen a holistic nutritionist? You see a registered dietitian, because we are upheld by those that we protect the public, and we're trained to provide medical nutritional therapy. So based on those conditions. So many times when I assess a client, or when I see someone, I had to see what else is involved in their life, you know, and including medications. I had to assess any food or drug interactions. That's what a registered dietitian does. So I think that will equip it with all the skills to kind of navigate to see all misinformation. And sometimes I might miss it. And nutrition is a fairly young science. You'll think that it's fairly young, actually. It's maybe been around for maybe 40 or 50 years. It's not a very old science, and it's constantly changing.
What are some of the true facts about diet and rheumatoid arthritis then?
The true facts about diet is, I'll bring you back to what is your baseline. Your baseline is if you don't have any other conditions that require some limitations of certain foods, the baseline, I always go back to the Mediterranean diet. To me, that's my gold standard. And I really love, because we always have that base of the plant-based base. So you have the whole grains, because we shouldn't be afraid of carbohydrates. We shouldn't be afraid of the grains. They actually contain the B vitamins that we need to metabolize energy. And aren't we always tired? Right? And so now we include the nuts and seeds, and obviously, and also fruits and vegetables. They're so important. Even though let's say the hallmark of the Mediterranean diet is olive oil, extra virgin olive oil, we shouldn't be afraid of using other seed oils. And so let's say that sunflower or canola oil, because lately they're also being demonizing those type of oils, but they also can bring some benefits. So they bring some cardiovascular benefits. So it's just about keeping that in moderation. Then we want to have, mostly from the Mediterranean diet, they favor the fermented dairy products. So you have like the cheese or yogurt, which we know have excellent benefits for your gut health. Then we have a fish, right? Like a seafood, at least twice a week if you can. A poultry is okay, like in the small amounts. Always remember the palm of your hand. I think that is such an old advice, but I think it still works. And you have, when it comes to beverages, they do favor alcohol, red wine, especially because of the antioxidant content. And for people with rheumatoid arthritis, it is okay to have your glass of wine, like, you know, on the weekends. Going to, before we used to say, oh my God, you're on a certain medication that it could affect, or you're in so many medications that can potentially impact your liver function. So many times we'll say that alcohol is a big no-no. But if you enjoy a glass or two of like red wine, it's okay. Maybe a beer here and there, it's okay if you enjoy it. What else is in that pyramid? And of course, but then with all the wave of anti-inflammatory talk, I will say adding those more herbs, like herbs and spices instead of loads of sodium. We also want to reduce the amount of, you know, processed meats and all the baked goods, especially because they contain like lots of saturated fat. And the saturated fat is, in fact, it's pro-inflammatory. It can trigger actually symptoms for you. If lots of water, it's important, like lots and lots of water. Green tea these days, coffee, even 1 cup a day in the morning, it actually helps you to get your bowels kind of moving. And once you're fine there, no bloating, I think you will be so happy the rest of the day. And so that's probably just the general kind of rule of everything. But as someone with autoimmune diseases, we know that we usually don't have just rheumatoid arthritis. We probably have other autoimmune diseases. We also may experience side effects from medications. And that's when a dietitian comes in handy, because they can help you modify from that baseline of that diet. What is it that you need to modify? What are the options? What you can swap? So for some people that truly have sensitivity to gluten or wheat, because that happens, that is, in fact, some people with autoimmune diseases, they have that sensitivity. Then you have to, with the registered dietitian, will make you think, is it really the gluten, or is it certain proteins in wheat that is causing you the issues or the problems? So that's when you really come to an individualize your diet.
Everyone is definitely different.
Mm-hmm.
Now, you mentioned that you are in remission and you have been for about 2 years. Can I ask what has helped you get there? And did diet have anything to do with it?
I feel the combination of things, and I think there are situations in your life that can kind of throw everything off. When I want to say this is because I was at some point also with minimal symptoms, but the talk about remission, it wasn't there. We've never really thought about it. I think that's fairly new. But when I got pregnant, everything went down the drain, right? And it was just logical because a woman goes through so many changes when we're pregnant. And the flare up that I had postpartum, it lasted almost 4 years. So it's out of your control. And even though during that time I tried different therapies, it still didn't work for me. I didn't think that remission was possible. And I said it's a combination of things because I think you have to be in a place that when you need to accept the help. And I also sought for mental health help because I felt that at some point it's just nothing was working. And it's not that it's mind over matter, but I think you do need to prepare your mind and to have the acceptance that, okay, this time it's gonna work. It's always having that hope and not giving up on and giving a try to these treatments. To this point, I can say for 20 years, I still believe that the side effects of rheumatoid arthritis can be way worse than the side effects of medications. Maybe that message may change in 5 or 10 years. I don't know, but so far that has been true to me. So I think being persistent and always having that conversation with your rheumatologist to me is essential. And to allow yourself for a change, because it was changing the medication, it becomes harder the more you do it. At first, you had that hope that it works for 1 or 2 years, and then it stopped working. It's like, okay, now I'm going to try one. And when you try different ones, you start to think, I'm running out of options. So I have to work like with my mental health, like therapist, I have to get that out of my head and say, okay, let's think about this present moment. Let's give this new therapy a try. Let's just give it a try. And it took me maybe a year to make that decision. When I finally made it, I realized that I was like, why didn't I take it sooner? But the thing for me is give yourself that opportunity to try those new therapies. Now most of them have been around for many years, and have your have that medical monitoring. So they're doing your blood work. You're also one of the things that my biggest markers for like knowing that I'm going into remission, it was the morning stiffness. Many times my rheumatologist changed my treatment because of the morning stiffness, not because of the inflammatory markers of my blood work. They were perfect, but I was still having 2 hours of morning stiffness. So that's when the rheumatologist said it's more than blood work. We have to do a clinical workup. Like, let's see your body holistically, how the pain is impacting you, how many sick days you're taking, the morning stiffness was a big one for my rheumatologist. And she made the decision of changing my treatment because of that, not because of the blood work.
Yeah, I think that is so important. Remission and, having well-controlled rheumatoid arthritis is more than just what the blood work says. It's how we feel about, describing to our physicians, like, this is how it's affecting me in the day. Yes, I have good blood work, but I'm still feeling this. And it's really important for us to bring that up to our physicians so they know how to appropriately treat us, or because they might miss something unless we don't bring it up.
It's true.
So, Christina, thank you so much for being such a fantastic interview today. Is there anything else that you would like others to know while we wrap up this interview?
Well, thank you, Eileen, for inviting me. And I'm actually enjoying having a lot of conversations on my Facebook group. It's called Eating Well with Rheumatoid Arthritis and Sjogren's. And I think keeping these conversations alive and don't be afraid of asking questions. And so it's always important for you to ask questions. I think even when you go to your rheumatologist, and I emphasize that a lot today, that you have that collaboration. It's still okay to ask questions and to maybe challenge some of those maybe therapies. Maybe you're not comfortable with it, right? So, but before I was taking this medication that I had to do it every month, and I after 6 months, I said, like, no, it's not working for me. And I said, no, but give it a try, until I had to say, like, no, it's not working for me. I need another option. So it is okay for you to come to your appointment, bring as many questions as you have. And most importantly is, I always keep that question in mind. What do I need to do to reach remission? Because now in 2024, it is possible.
Mhm. Mhm. Remission rates have definitely gone up. And I'm so happy for you that you have reached remission. I've been close and I'm on the journey again. And talking to you today gave me a little bit more hope. So thank you.
Oh, you're welcome. Thank you for this conversation.
Sure.
Bye-bye.